Welcome everyone. Let's welcome our resource person today, Jabi sir. Sir, we'll start now.
Sure, sir, I can start.
Hello. Yes, we'll start.
So, hi everyone, am I audible?
Yes, sir, you are audible.
I'm
Yes,
trying
sir, you
to
are
share
audible.
my screen.
Are you able to, sir?
Yes, I'm doing, sir. 1 minute. Let me. Is my screen visible, sir?
Oh, yes, sir. Yes.
Okay. So, hi friends. It's very nice to meet you all, and it's a very honor to me to participate in this webinar, to lead this webinar. First of all, I thank the host, the organizers, to give me this opportunity. So, let us start. So, my topic, what we are going to discuss today is physiotherapy management for improving visual acuity in subjects with myopia. I hope each one of you, everyone have might be knowing what myopia is, right? So what I have to say initially is, as physiotherapists, we the physio community have always centered our focus on common conditions such as osteoarthritis, disc bulge, stroke, etc. But I think it's a high time for us to focus on our attention on unique conditions such as myopia, presbyopia. Recently, we were doing one research on GERD, gastroesophageal reflux disease. Like that, we can actually enhance the circle of practice, right? So I thought I would stand up with this innovation, so something unique, so that yeah, and this is very useful for this will be for very useful for you people for sure. So I hope everyone will be cooperating. I will be taking just 20 to 25 minutes, that's all. So we'll continue. First of all, let me say you a short story. Okay, when I was at the age of 15. It was for the first time I got visual problems. Okay, I was not able to focus on board when I was on schools. Then my father took me to an ophthalmologist, and what he did is he graded my vision with the help of a Snell's chart. And he asked me to use spectacles regularly. Okay, using contact lenses regularly, and he promised me, which actually surprised me later, because he told me that using contact lenses for on a regular basis can help you to improve your vision. And let me ask you, how many of you support that statement? Anyone? Let me ask
Sir,
you, how many of you are
mic is
supporting that
mute.
statement? Regular
Yes, sir.
uses of spectacles
Hello,
or
sir.
contact lenses can help in improving vision. Okay. Yes, sir. Please. Hello.
Yes, sir. Mic is unmute, so they can't speak now. Later we can ask questions, sir.
Okay, sir. Okay, sir. So let me continue.
Yes, sir.
Okay. So first of all, let me say what myopia is. Okay, myopia is also known as a nearsightedness and short-sightedness, which means a patient. It is a condition where a patient can only see near objects, and he is having difficulty in seeing far by objects. This happens when the shape of your eye fails to keep light from focusing correctly on your retina, and hence make far away objects looking blurry. Okay, first we'll go to an overview of eye anatomy. Okay, the eye is a complex responsible organ responsible for vision. Okay, it is approximately 2.5 centimeter of diameter. It is having a diameter of 2.5 centimeter. It is having three main layers. The first one is fibrous tunic layer, then vascular layer, and neural tunic layer. The neural tunic layer is also known as retina. Okay, there are three main layers, as I said. The fibrous layer is also subdivided into sclera and cornea. The white part is known as sclera, whereas the transparent part is known as cornea. The cornea is also a dome-shaped structure in front of the sclera. It is highly sensitive to touch, containing nerve endings, but lacks blood vessels. The third layer is vascular layer. It is also having ciliary bodies. It contains the ciliary muscles. Having the ciliary muscles are actually responsible for the process of accommodation. We will go through it later. Okay, then I will show you the figure. What visual acuity is. After understanding what myopia is, we have to go to visual acuity. What visual acuity is. We all know about gaze stability, right? Our gaze stability means while we are traveling on a bus and we are reading a book, okay, by the time the bus will be on a gutter and we have to focus our vision on our like readings, letters, right? The ability to focus, the ability to distract the distractions is known as visual acuity. There are two types of visual acuity, static visual acuity and dynamic visual acuity. Visual acuity refers to the ability of the visual system to discern, find distinctions in the environment as measured with printed or projected visual stimulus. Coming to the basic anatomy. In the figure, you can see the eyeball. Okay, how the normal physiology works is when the light rays are falling on the lens of the eyeballs, the lens converges these lights to fall into retina, and the image is formed erect on retina. Okay, as the light rays falls on the lens of the eyes, the lens, it does is it converges the light rays so that it can fall on the retina and the image is formed in retina. Okay, this much I hope you people are knowing. And in this figure, you can see a blue arrow mark that shows the diameter of eyeball. As I said before, the diameter of eyeball is 2.5 centimeter. And you can see here ciliary muscle. Ciliary muscle is a muscle which is encircling the eyeballs. Okay, and as you can see in this figure, the fibers are thickly located. The fibers of ciliary muscles are thickly located near to the lens of the eyes. Okay, and what is the primary function of this ciliary muscle is the actual soul of this topic. Okay, we have to do some work. We have to do some rehabilitation work on this ciliary muscle in order to enhance rehabilitation of vision. Okay. So basically, coming to ciliary muscles are supplied by nerve fibers, oculomotor nerve fibers 3. Okay, three fibers of oculomotor nerve. Then it is the blood supply is by ophthalmic artery. It is the branch of common carotid artery. It is the branch of internal carotid artery. And what is the primary function of this ciliary muscle is accommodation. As you can see, what accommodation is. The state of ciliary muscle changes depending if we observe distant or close objects. When looking at distant objects, the ciliary muscle is relaxed. The zonular fibers are tightened and the lens is flattened. As you can see me in the video, when I am holding a rubber band, okay, and the rubber band, we can enlarge it. We can increase the diameter as well as we can decrease the diameter of the rubber band when it is a circle. Okay, likewise, the diameter of the eyeballs also can increase and decrease. Okay, that is actually the process of accommodation known as. Okay, when the ciliary muscles changes depending if we observe distant or close objects. When looking at distant objects, the ciliary muscles are relaxed. And when we are looking at close objects, the ciliary muscles will be contracted. Okay, so in this state, the refractive power of the lens is enough to form a clear image of the focused object on retina. However, in order to focus on a close object, the inner structures of the eye must adapt, which is possible through the process of accommodation. Let me ask you, what is pseudomyopia? What I believe myself is that initially I might have been diagnosed with pseudomyopia, which gradually progressed into myopia. You people may be wondering why I am wearing a spectacles taking this class. Okay, and I am claiming that physiotherapeutic management can improve vision. Then why I am wearing these spectacles? There is a reason, because the uses of spectacles, some of the review of literature, some of the evidences shows, some of the literature shows that using of lenses are actually splinting a muscle. It is actually causing the muscle wastage. Okay, so when I was using the spectacles more than a period of 10 years, which actually was actually a splinting for the muscle, for my ciliary muscle. Okay, pseudomyopia occurs when a spasm of the ciliary muscle prevents the eye from focusing in distance, sometimes intermittently. This is different from myopia, which is caused by the eye's shape or other basic anatomy. It is common in young adults who have active accommodation and classically occurs after a change in visual requirements, such as students preparing for an exam or a change in occupation. Let me say you, we have so many, we know so many children around us, right? And those children know when they start with their mobile addictions, the frequency of their mobile usage increases. By the time they will be having some sort of visual disturbances, and we may be misdiagnosing it as myopia, and we will be subjecting them to wear contact lenses. But in every cases, most of the cases, myopia starts with pseudomyopia. I can show evidences also. Okay, let me say what actually causes myopia. Gracia Montero et al. In the year 2022 conducted a study. It claims that nearly 24.1% of Chinese children were found to have pseudomyopia. And the presence of pseudomyopia highly affects the risk of myopia, leading to lifelong short-sightedness. As I said before, the spasm of the ciliary muscle is causing pseudomyopia. What is the actual cause of pseudomyopia? Is spasm of ciliary muscle. Saying one more thing about ciliary muscle is that ciliary muscle was considered to be in the category of smooth muscles. Okay, later on, recent studies are claiming that ciliary muscle is not coming under the category of smooth muscle. Instead, it is coming under the category of skeletal muscles. So what is the difference between smooth muscle and skeletal muscle is, smooth muscles, we cannot train it. Okay, the adaptation cannot be happen in smooth muscles. But in case of skeletal muscles, we can actually train it. That is the difference. So by standing on these evidences, I can say that we can actually train ciliary muscles. That is my claim. That is the hypothesis of the study. Okay, evidence-based. We can see so many evidences. Our study findings provide important evidences that this is a study published in the British Journal of Ophthalmology. Children with pseudomyopia are more likely to develop myopia than those without. So most of the cases where we have diagnosed with myopia is actually starting from pseudomyopia and gradually progressing into myopia. A total of 2,328 children were included in the final analysis of the study. During the 6-month follow-up, 21.1% pseudomyopic eyes developed myopia. So when the person is diagnosing with pseudomyopia and the cause of pseudomyopia is muscle spasm, why can't a physiotherapist approach for the treatment? This is what I thought before entering into the study. Okay, why can't a physiotherapist deal with muscle spasm? Even though ciliary muscle is deep muscle, why can't we find some strategies to improve it? So I went through so many articles. So let us discuss about what contact lenses do. Like as I asked before, does regular and continuous usage of contact lenses helps in improving vision? The answer is no. There are no any proven physiological evidences showing that continuous usage of contact lenses will be helping to improve visual problems. Okay, it actually only delays the loss of vision. It actually helps only in delaying the loss of vision. That's all. Okay, and there are no physiological evidences proved that the use of contact lenses are helpful for improving vision. So let me ask you, if a condition, if a disease is diagnosed and the basic cause of the disease is known. And if that basic cause cannot be treated, then what is the use of wearing spectacles? Wearing spectacles can obviously delay the loss of vision, but it is not treating the cause. Thus, I came up with the question: why can't we do an intervention? And I hope this will be a breakthrough. And all of you, I'm requesting all of the physiotherapists to do practice this. When I was a child, 15 years old, my father took me to an Ayurveda center in Trivandrum, Kerala. There they were using Trataka Yoga Kriya. That was a Yoga Kriya, basically practiced eye exercise. They asked me, they made me to do some eye exercises, and I didn't use spectacles for more than 3 months regularly. And what I experienced is I experienced an improvement in my vision. Okay, when I was a child. Okay, then that time I was not even thinking that I will be coming into physiotherapy field and I will be doing a research on this. I was not even thinking. But later on, when I came into this field, when it was my time to do a research, I was thinking back, okay, why can't I do a research on this? And I have searched so many articles, and this article was very interesting. The author was Komal Krishna. It was an Indian article. It was a comparative study on the effects of vintage non-pharmacological techniques in reducing myopia. This article combined the techniques of Bates eye exercises and Trataka Yoga Kriya. Trataka Yoga Kriya is the Ayurvedic method which I followed when I was a child, and I had an experience of improving my vision. So I request all of you, please try this out with people who is having pseudomyopia. How to diagnose pseudomyopia, I will tell you later. The next article I want to introduce you is the Robin et al. The Robin et al. Article, the effect of physical activity combined with extra ciliary muscle training on visual acuity at children aged between 10 and 11. This is an physical activity combination with ciliary muscle training program. This is also a very interesting article. I can share you this article if anyone wants. You can go through this. So first we will see what is Bates therapy. Okay. Bates therapy is an ineffective and potentially dangerous alternative therapy aimed at improving eyesight. Why I highlighted the word ineffective is the Bates therapy is actually prohibited from so many countries. The Bates therapy is actually banned from so many countries. It is developed by William H. Bates in early 1930s, but this Bates method is banned from so many countries because of its strategies. We'll go through its strategies. Okay. The first one was eye movement exercises. That is very simple. We will be moving the eyeballs around the eyelids as an exercise. There are specific standardized pattern to do that developed by William H. Bates, which is described in the article. The second one is palming. As you can see in this figure, the girl palming her eyes. Before palming her eyes, the girl should be rubbing the hand like this. We will be rubbing the hand. There will be mild heat produced, and this heat we can apply on our eyes. This is the simplest form of this technique. The third one is sunning. Because of sunning this technique only, this Bates therapy was banned from so many countries. And it was actually concluded that it is an ineffective technique because this sunning actually caused so many damages deep inside the eyeballs. Okay. So in this technique, the sunlight is converged through a lens into our eyeballs, which actually didn't help to improve vision, but actually helped in, actually contributed in losing of vision only. So that so many countries banned this technique. So what I did in this study is, in my study is, I combined some techniques of Bates, excluding this sunning. The other techniques I have taken from Bates therapy, I have added it with conventional eye exercises along with Trataka Yoga Kriya, and I have also done ciliary muscle training. I will explain all of this. Okay. First, we'll see Bates therapy and Trataka Yoga Kriya. This I have taken from the Mother article. In Mother article, the group A, the participants performed eye exercises for 8 weeks. The exercises given to this group were based on Bates technique near to far shifting. How to do near to far shifting is the patient will be standing behind iron rods of windows. Okay, the patient will be standing behind windows. The patient will be focusing on a distant object, either a tree or a house, something. The patient will be counting until 10. 10 seconds, the patient will be focusing the vision on a distant object. Suddenly, the focus of the vision has to change and it has to be concentrated on the iron rods of the window. Okay, and near to far shifting, the sudden shifting of the focus from near to far. This is the basic concept of this technique, and you can practice this. You can actually see this is effective. Effective. Okay. Why the slide is changing? I'm not understanding. Okay. Next one was palming. As I said before, it is included in Bates technique. The patient will be rubbing their hands together. There will be some sort of heat produced in the hand, and that heat is placed on the eyes. Okay, next one is solarization, which I have excluded from my study. Third one is eye wash. Next one is eye squeezing, eye circles, and eye massage. Eye massage also I have excluded because there were so many contraindications for eye massages. Eye circles means there is a particular pattern and timing proposed by Bates, William H. Bates. In that particular pattern, the patient has to do eye circling. Okay. In group
Sir,
B,
slide is not changing, sir.
I
It's
will change
a
it, sir.
bed cells plus Trataka.
There only I am, sir. In
Okay, okay,
group
sir.
B, in the mother
Yes, yes,
article,
yes, 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 yes.
Trataka Yoga Kriya was performed by the participants for 8 weeks. The following activity was done by participants of this group for 8 weeks. Trataka means steady gazing. It can be done on any external object such as candle, a leaf, or a crystal, anything. Okay, basically what Trataka Yoga Kriya is, the patient will be sitting on a dark room. Okay, there will not be any distractions, there will not be any lightings on this room, and there will be a candle placed straight to the eyes of the patient. The patient will be sitting with back straight, and the candle light will be placed at straight line of the patient. Okay, the patient will be asked to focus their vision on the candle, and the patient has to count till 100. After counting till 100, the patient has to blow off the candle and the patient has to close his eyes. While closing the eyes, the patient can see an image of an imagined visual of candle light blowing inside his eyes, and he has to concentrate it. Okay, he has to hold it for another 100 seconds. Okay, and the visual image will be converging. It will be becoming small. Okay, but the patient has to concentrate on it with full concentration and effort. This Trataka Yoga Kriya claims to not only just to improve vision, but also it claims to improve concentration also. And this was also very effective when I performed this. This actually helped me in doing, helped me to improve my concentration in my studies also. Next one is ciliary muscle training. How to perform this? This is the most complicated technique from this. Okay, from my study. Ciliary muscle training is actually something done in between sports activity. The patients are subjected to do sports activities such as basketball or football playing or cricket, anything. And in between that, their ciliary muscle training is done. How it is done means there will be some elements, some wordings or some letters pasted on the balls, either in football or in basketball, and the letters will be pasted around also, around the ground where the patients are playing. Okay, either it can be pasted on the bat where the batsman is batting, or it can be pasted on the shoulders or chest of the fielders. And while playing, while the patients are playing, to they were asked in between to focus on the letters and read out the letters loudly. Okay, thus we were trying to train the ciliary muscle. Okay, the ciliary muscles were slowly adapting during this process. This is also a very effective process. Next one is conventional eye exercise. Conventional eye exercise are traditionally practiced exercises. They are turn and stretch the eyes far to left, right, left and right, continuing the movement back and forth from left to right for a repetition of 10 times. Turn the eyes upward or turning the head for 10 times. Then raising the eyes, looking up around in a circle, shut eyelids. Basically, conventional eye exercise therapy is not having any proven evidences. Okay, they are just making the eyeballs to move around the they are just making the lens to move around the eyeballs. Okay, what physiological effect it causes is unknown. And wherever I found this in articles, they were saying like it will be enhancing the blood circulation. But in base therapy, the palming technique, when we are applying the heat of our palm to the eyes, it actually contributes in enhancing the blood circulation. But I don't really think that conventional eye exercises really help. So in my study, I have categorized my patients, my subjects into two groups. Okay, for them, I have done initially I have screened them using Sneller's chart. There are two basic outcome measures for charting, for categorizing, for what to say, um, for grading vision. Okay, first one is Snell's chart and second one is Bailey-Lewis chart. Snell's chart is more what to say, reliable source. So I used Snell's chart in my study, but using Bailey-Lewis chart is more specific than Snell's chart. This is one exercise coming under base therapy. In this exercise, what the patient does is the patient will be standing straight with wide base of support, and the patient will be holding a tennis ball in his hand. The patient will be throwing the tennis ball to the ground, and the ball has to bounce back to his left hand. The throwing will be starting from the right hand, it will be bouncing back to left hand. While doing this, the patient has to concentrate on balls, but his face should be stabilized. The gaze stability is very important while performing this exercise. Only his eyeballs has to move, not his head. Okay, the patient's head should be stabilized and the complete focus of vision should be in balls. This is very, very effective exercise you can practice. This is another technique. This is one of my patients. She was also doing base therapy only. But in this technique, different from the other one, the patient will be holding tennis ball in one hand and it will be thrown to the other hand. The patient will be throwing the ball with one hand and will be catching with the other hand. While performing this also, the head should be stabilized. The head should not move. Only the eyeballs have to move along with balls. The vision has to be concentrated with eyeballs. Next one is ciliary muscle training. For performing this, I have assigned some football players, also the basketball players. We have rented a court for this, okay, and we have done this study for 12 weeks. But ciliary muscle training, I could only do once in a week. Okay, once in a week means only 1 hour session per week. Like that, 12 weeks was the duration of my study. The materials required, as you can see in this figure, I have prepared some cones where letters were attached. Letters and figures were attached, and I asked the patients, these patients were actually having visual problem, myopic patients only, and all of them were having severe myopia. Okay, not even a really near object they were not even able to see. Like they were only able to read. Okay, reading newspapers they were able to do, but reading a board while traveling on road they were not able to do. So while seeing this figure, you may feel like they are able to see and read that letter easily, but it was not actually. Okay, actually they were facing a lot of difficulty to read that letters. And I have assigned them, I've asked them to do sports activities and read out the letters loudly. The patients, I asked them to kick the ball to the letter A and kick the ball to the letter B, like that. The patients were following those instructions. And for the duration of 12 weeks, we performed this. We also tried in basketball way. We also tried in volleyball way. The ciliary muscle program was also seems to be effective. Okay, what happens in sports activity is the author of this article claims that in sports activities, while performing the sports activities, the blood circulation is very enhanced. And it also helps in training of ciliary muscles. It also contributes, the energy will be distributing all through the body equally. The next one was 20-20-20 rule. This is actually not an exercise, but a precaution. This precaution I have mentioned, I've asked my patients to keep this precaution. This is a this is a rule designed to reduce eye fatigue. 20-20-20 rule says that every 20 minutes of screen time, you should look away at something at least 20 feet away from your distance for at least 20 seconds. Okay, these regular screen breaks give your eyes some much needed rest and help preventing eye strain. Okay, 20-20-20 rule, you people can also practice in your daily life. All of us are addicted to phone mostly, and we are actually using phone on a regular basis. So 20 minutes of screen time, either it is laptop or television or phone, anything, we can stop at 20th minute and we can concentrate our vision on a 20-meter far object for 20 seconds. Methodology of this study, the treatment duration was 12 weeks. The sample size was 30. 15 subjects were assigned into group A and 15 subjects were assigned into group B. The exclusion criteria which I had to keep in the study was subjects with astigmatism, where the curvature of lens is not equal. So, and then the subjects with macular degeneration, subjects with optic neuritis, subjects with glaucoma, subjects with optic nerve atrophy, subjects with cognitive or motor dysfunction, and presbyopia. Presbyopia develops after the age of 30, and which actually cannot be cured permanently. The comparison of pre-test and post-test, this I have done statistically, where I could gain a p-value of 0.289. The gender-wise distribution was also a big factor in the study, because the visual acuity of male and female is different. The visual acuity in male is different from the visual acuity of female. It is also claimed by the author of the mother article. While concluding, based on the statistical analysis, the result of present studies shows that there is a statistically significant difference in the frequency of pre-test and post-test values of the experimental and control groups. The experimental group showed more significant reduction in visual acuity problems in subjects with myopia. Thus, the study concludes that combined efficacy of base therapy and ciliary muscle training is more effective in reducing visual acuity problems in subjects with myopia. Therefore, the study rejects null hypothesis and accepts alternate hypothesis. The limitations of this study was individual responses to exercise were varied. Some of them were not willing to do exercise on a regular basis. Unequal distribution of gender. As I said before, gender distribution actually contributes in the study, because the visual acuity is different in both genders. Subjects within the age limit of 20 to 40 were only included in the study. Performing, so we are not aware about people above the age of 40. Okay, that is a limitation. Performing solarization technique in base therapy was found difficult for more individuals. So while performing base exercise therapy, which the solarization which I have excluded, okay, I also tried to implement in some subjects, but their reaction was very it was actually very disturbing for the patients. This study, when I presented this study in government physiotherapy conference held at Kerala Thiruvananthapuram Government Medical College at the year 2023, I got first prize for this, and I request all of my friends to come up with more studies about gaze stability, about visual acuity, and treating myopia. Thank you. Any doubts you can ask.
Sir, can we have a question answer session now?
Yes, sir. Please.
Yes. I will unmute them.
Okay.
Now you can unmute yourself.
Hello, sir.
Yes.
Hello.
Yes.
Sir, you told now wearing specs won't like increase our eyesight. But if we are using specs and if we are not wearing means that will affect us. Hello. Hello, sir.
Sir,
Hello.
unmute yourself. Sir. Jabir sir, unmute yourself. One second. I think some technical glitch is there. Jabir sir, unmute yourself, sir.
Hello, am I audible, sir?
Yes, sir. You are audible now.
Can you repeat the question? I couldn't hear it properly.
Sir, you told now that if we are using specs, our eyesight won't increase. But if
Yes.
we are using specs and if we are not using that specs means like that vision will like reduce.
Using of contact lenses or spectacles can actually help in delaying the
Spectacles.
vision loss. It actually helps in delaying the
Okay.
vision loss. Okay. It cannot
Okay. So
help
it
in
will be that
improving vision.
permanent only. Okay. Okay. So we should, if we are using specs, we should wear continuously.
Even if we are wearing continuously, that also has some contraindications. But I am not going
Okay.
much deep into it because actually the author of the study claims that it is actually splinting. Like consider my biceps muscle, I am splinting this. What will happen? Muscle wasting will be happening. I am using
Okay.
these spectacles for more than 10 years. So think about the condition of my ciliary muscle. It was being
Okay.
splinting the muscle. So
ଦିଟା ନଉଥିଲା ପେଣ୍ଟ ସାର୍ଟ
Good evening, sir. So, how do we
good evening.
diagnose pseudomyopia? So, you said you will tell us how to diagnose it from myopia. So, how can we?
କେଉଁଠି ଦେଉନାହାନ୍ତି ପଇସା ଦେବ ପେଚ ନେ ମୁଁ ଚାଲି ଦେଇଥିବି
Hello. Am I audible?
Yes, sir,
Yes.
you're audible, sir.
ଦେଖୁନୁ
Someone was asking something about pseudomyopia. Can you repeat it, please?
So, how to diagnose pseudomyopia, sir? How can
Okay.
we differential diagnosis from myopia?
Okay. So pseudomyopia is actually a short-term condition, whereas myopia is a long-term condition. Pseudomyopia heals by itself. Most commonly, it heals by itself. But what actually happens is the author claiming that pseudomyopia diagnosed people subjecting to use their spectacles is actually splinting the muscle, and hence they are forcing to get diagnosed with myopia.
Sir, I have
So if you're going to an ophthalmologist and they say that you have myopia, you have to wear specs. So can we conclude that majority of teenagers actually have pseudomyopia?
Yes, actually, the prolonged usage of spectacles, we cannot control those populations. But the people who start their visual, they are in the starting stage. They are in the starting. The people who are in starting stage, we can actually heal them. We can actually heal them through exercise.
अभी ये खड़ा हुआ अभी तक
Okay, thank you, sir.
ये टाइम हो गया
Sir, I have a one question.
Okay, please.
Sir, actually, they will they will suggest the contact lens after the surgery of keratoconus. I'm using from already 1 year. But
Okay.
you said it only improves like that, but my doctor said like it will protect your eye and it increase your eyesight like that. Why that?
Actually, this is a debate. Okay, this question even I had to ask to my ophthalmologist when the ophthalmologist who I met in my childhood. There are
Okay.
no proven evidences. If you can find any proven evidences, physiological evidences behind that, you may please share with me. Like
Okay.
usage
Okay.
of spectacles will be improving vision.
Yeah. Like that they said like if you wear contact lens, it will protect your eyes and it increases eyesight like that. But till now I didn't like my eyesight has been not increased that much. So you said no,
Same.
it will only protect like that. No, it will not like that. So I asked this question. I got that doubt.
Exactly. Okay, you can actually search for this. This is actually a debate between physiotherapists and ophthalmologists. We can
Yes, sir.
actually come up with the studies. You can. There are a lot of scope for the study.
Yeah, actually, in physiotherapy and ophthalmology is like we don't have that concept, no, in physiotherapy management of
Mm,
this eye concept.
yes.
It's a good concept today. I
Thank you.
really felt it is a good.
You can also come up with your
Thank.
studies, and you can find evidence. Search for evidences whether contact lenses will improve eye vision. No, it will not.
Okay, sir. Do.
Mm.
I'll do this. Yeah.
So, being a physio, how can we differentiate between a pseudomyopia and myopia?
So this is an interesting question. Okay, so whenever we diagnose a patient in the starting stage of myopia, we can actually try with the exercises. Okay, the subjects assigned in my group, they were categorized into two groups, Group A and Group B. Group A people, 15 people, they were teenagers. They were in a starting stage of myopia. And when I performed this, they very exactly what to say. They were actually, they got a very good improvement. Okay, you can actually practice by yourself. Then only you can feel the improvement. This Trataka Yoga Kriya also, if you people are students also, before examination, if your people are practicing Trataka Yoga Kriya, you can actually improve your concentration also. You can feel it by yourself. Eye vision also, Bates therapy, excluding that solarization, you can practice and you can feel it by yourself, how improvement it is.
Okay, sir.
So what was the your range of visual acuity? Like what till what power or spectacle power you had subjects in your study?
Okay, so point in Snell's chart, in Bailey-Lewis chart and Snell's chart, both are different. Okay, Snell's chart is a very, what to say, the Bailey-Lewis chart is more uh, specific. It is having more specific decibel values. So the subjects which I have screened is in the group A was in the starting stage, which is at less than 0.05. Okay, and for group B, which I have categorized, I have classified with 0.07.
Oh, okay, sir. Thank you, sir.
Hello, sir.
Hello.
So the thing is, the pseudomyopia, it is a problem with the
Okay.
ciliary muscles. And
Okay.
myopia itself, as I've seen from this lecture, is a problem with the entire eyeball, right?
Yes.
In that case, whatever we have seen today, it will be helpful in preventing, pseudomyopia from progressing into myopia. But what does it do for myopia itself? The main condition. We can see that it will definitely help in preventing pseudomyopics from progressing into myopia. But my question is, how does it reverse the shape of the eyeball? Is it possible to do that, or is it still in debate at the moment? Whatever we've seen right now, I can agree that it will definitely affect the ciliary muscles. I'm talking about myopia. How does it reverse myopia as a condition?
Sir, when does myopia occur, sir? As you can imagine, if I had a rubber band, you can imagine a rubber band on my hand. Like as eyeballs can actually increase its diameter, and it can actually reduce its diameter. That is the process known as accommodation, the process of accommodation, which is actually done by ciliary muscles. And if we are training ciliary muscles, we can actually enhance this process. Myopia occurs when image is formed, image is not formed on retina. It is falling in front of retina. When the image is falling in front of retina, myopia occurs. And if the process of accommodation, the ciliary muscle can perform process of accommodation well, the image can be formed on the retina and the vision can be corrected.
Sir, in your participants, you did mention that they were all, some of them were myopics. So did they do this, did they do their workouts, the exercises with their spectacles, or did you have them remove it so they can, try to see how far they can go with their normal?
I asked them to remove the spectacles.
You asked them to remove their spectacles?
Yes.
Okay. Thank you, sir.
Good evening, sir.
Good evening. Please ask.
So you say that physiotherapy can train the ciliary muscle, but in case of binocular vision dysfunction, can we use that protocol to prevent the binocular vision dysfunction?
No, that is exclusion. That is in exclusion criteria. There are so many exclusion criteria.
Can you
We are only
please
focused
explain
on myopia and pseudomyopia conditions. There are so many congenital genetic conditions also where we cannot do anything. The curvature of eye itself is unshaped.
Okay, sir. Thank you, sir.
So is there any knowledge on if Trataka yoga will work on astigmatism and hypermetropia?
Hypermetropia is farsightedness. We are concerned with nearsightedness.
Yes, sir. No, sir, I'm asking if you have any knowledge if Trataka yoga or ciliary eye muscle exercises will work for hypermetropia or not.
Actually, the articles which I have gone through, they are concentrating on myopia only. I don't know about hypermetropia.
Oh, okay, okay.
The pathophysiology is different from myopia and hypermetropia.
Yes, sir.
Hello.
Hello.
Sir, for example, a child is having from childhood there is facing a problem of eyesight, it means myopia, and the doctor says that okay, after your like age of 10 or 12, your eyesight will become better. Later, still it is getting increased. As a physio, what we can do for them?
Actually, by the age of 20 or 22, the progressive vision loss will cease. In myopic condition, most common myopic conditions, there is a progression of vision loss that will be ceasing at the age of 20 or 22. Okay, but there are no proven evidences that it will be coming back. That if you can find any evidences, you can show me. Like if doctor claims also, you can actually ask the doctor only. What is the proven evidence? Any physiological evidence you can give me? Like it will be coming back to normal. I don't know. It can only cease the progression. As of I know.
As a physio, can we give all this Bates therapy? Can we try those things?
You can definitely try, except that solarization technique.
Okay. Okay, fine.
Sir, we'll wind up now. All question and answer clear nowadays. Hello.
Yes, sir.
Dear all, we'll
Yes,
we'll
sir.
wind.
Thank you so much.
Hello, sir.
Hello.
Hello.
Sir, can you,
Now we'll close it. Dear
sir,
all
sir, sir,
participants.
sir, only one question, sir.
Okay. Okay.
Sir, can you please tell me what should be done if a matchstick gets stuck in the throat of a few month baby?
What can you repeat this?
Sir, can I tell in Hindi?
I don't know Hindi.
Oh. Sir, can you please tell me what should be done if a matchstick gets in a neck of a few month baby?
Sir, are
I'm
you
not
able to
getting you
understand his
actually.
question?
No, sir.
Yes,
This question is not related to eye of Thana.
Sir, we'll connect you with personally Anand Kumar sir. Then we'll have talk on this because it's
Sir,
not a
Okay.
topic.
is there another? May I ask another question?
No, sir, no, sir.
We'll close.
Okay.
Thank you guys for your participant. Kindly leave your feedbacks in our group so it will motivate us for next webinars.